Hi friends, welcome to the channel The Nurse. Here we are discussing about NIMHANS nursing exam practice questions and answers with their rationales. It is third part of our NIMHANS practice questions. So if you are not watched our previous video, means I have attached it to in our playlist NIMHANS nursing exams and previous questions and answers also I have made separately in that playlist. So you can go and watch that one. So we will go to the topic, that is demands nursing exam model questions part 3. First question: which of the following is a type of abnormal behavior that involves persistent and excessive fear of a specific object, situation or activity? Phobia, obsession, compulsion, impulsion. Correct answer is phobia. So, in coming words, coming time, I will explain each and every options. So, first we will see what is phobia. Phobia means it is a type of abnormal behavior that involves persistent and excessive fear. Excessive fear of specific object. It may be against some particular object or towards some particular situation or activity that is out of proportion to the actual danger posed by it, because that person have excessive fear. Normally very minimal fear or minimal danger causing situation, for particular persons it will be an excessive fear will be there. So that is known as phobia. uh, it can cause significant distress and impairment in functioning and can lead to avoidance or escape behaviors. So that person particularly try to avoid that phobia causing situation or phobia causing activity or object. Phobias are classified under anxiety disorders. Next question. Which of the following is a type of abnormal behavior that involves repeated and ritualistic action that are performed to reduce anxiety or prevent a feared outcome? Options: phobia, obsession, compulsion, impulsion. Here, correct answer is compulsion. So we will go to the definition of compulsion. So in previous question we have learned about phobia. So now we will move to the definition of compulsion. Compulsion means it is a type of abnormal behavior that involves repeated and ritualistic action that are performed to reduce anxiety or prevent a feared outcome. Compulsion means that is a kind of behavior or action or activity to reduce their anxiety. If it is not done, means the person will be over anxious. So he has to complete that anxiety causing situation. It is often driven by an obsession, which is an intrusive and irrational thought or image that causes anxiety or distress. So, obsession and compulsion is very interrelated. Obsession means it is a thought process. There will be some irrational thought process, and this irrational thought process it leads to compulsion. Compulsion means activity or behavior. Obsession is thought process, compulsion is activity or behavior. So that is the relation between obsession and compulsion, usually seen in obsessive compulsive persons. These symptoms will be prominent in this personality disorder. Compulsions are not realistically connected to the source of anxiety and are not enjoyable or satisfying. Compulsions are a core feature of obsessive compulsive disorders, OCD. Third question: which of the following is a type of abnormal behavior that involves sudden and irresistible urges to act on impulses that are harmful to oneself or others? Phobia, obsession, compulsion, impulsion. So it is little bit confusing. So there is a confusion between compulsion and impulsion. So phobia, obsession, compulsion also discussed. So we will see the question answer. That is, answer is impulsion. Why it is impulsion means it is a sudden action, sudden and irresistible urge. that will leads to impulsion. Compulsion means that activity that used to reduce his anxiety. So impulsion always there will be a danger to the person or the nearby neighbors. Compulsion means that will be a planned. It may be a planned one, or it may the person will be in a safer uh, situation after the compulsion. Impulsion may cause dangerous to person or nearby persons. So we will see the exact definition here. An impulsion is a type of abnormal behavior that involves sudden and irresistible urge. That is a keyword in definition of impulsion. Sudden and irresistible urges to act and impulses that are harmful to oneself or others. So it may be due to some quarreling or argument with some other, and the person will do something with the impulse of that particular argument suddenly, and it may cause danger to that nearby person or to himself also. It is impulsion means it is performed without a forethought or regard for the consequences and often result in regret or guilt. So after the impulsion only, the person will get a regret or guilt feeling. It can impair social, occupational, or legal functioning and cause significant distress. Impulsions are a core feature of impulse control disorders such as intermittent explosive disorders, kleptomania, pyromania, or pathological gambling. So impulsions also have some symptom relation with some psychiatric condition like intermittent explosive disorder or IED. Okay. Fourth question. Which of the following is a type of abnormal behavior that involves severe mood swings between depression and mania? Bipolar disorders, borderline personality disorder, schizophrenia, dissociative identity disorder. It is an easy question. You can answer. A bipolar disorder is a correct answer here. Bipolar disorder is a type of abnormal behavior that involves severe mood swings between one is extreme depression and another and it is just opposite to depression, that is manic. So these are the characteristic feature of bipolar disorders. If one time patient had depression means next time he will get manic episodes. So this course he may be very depressed at that time, and the next the symptomatic time he may be manic. So that is the peculiar feature of bipolar disorders, BPAD, bipolar affective disorder. Depression is a state of low mood, loss of interest, and reduced energy. Same time, mania is just opposite to that. It is a state of high mood, increased activity, and impaired judgment. Bipolar disorder can affect various aspects of a person's life, such as cognition, behavior, sleep, appetite, and physical health. Bipolar disorder is classified as a mood disorder. So, mood disorder includes mania, depression, BPAD, bipolar disorder also a part of mood disorder. Fifth question. Which of the following is a type of abnormal behavior that involves the presence of two or more distinctive personality states that recurrently take control of the person's behavior? Bipolar disorder, borderline personality disorder, schizophrenia, dissociative identity disorder. Correct answer is dissociative identity disorder. Previously, it was known as multi-personality disorder. Now, it is classified as dissociative identity disorder. Multi-personality disorder, it is changed. Now it is known as dissociative identity disorder, DID. Dissociative identity disorder or DID is a type of abnormal behavior that involves the presence of two or more distinctive personality states that recurrently take control of the person's behavior. The persons will entirely behave like that entirely different person after some time. So that is a dissociative identity disorder. He may forget the previous character of a previous identity, and he will behave. Sometimes he will behave different religion or different persons or different sexual perception also. Each personality state has its own identity, memories, emotions, and behaviors. So each character may have separate identity, memories, emotions, and behaviors. There will not be a relation with the previous one and current one. The persons may experience gaps in memory for personal history or events. DID, dissociative identity disorder, is often associated with severe trauma or stress in childhood. DID is classified as a dissociative disorder. Next question. Which of the following is the most common mode of transmission of healthcare associated infection or HAI? Airborne, contact, droplet, vector-borne. Correct answer is contact. Healthcare associated infection transmission, common transmission is contact transmission. Contact transmission is the most common mode of transmission of healthcare associated infections, accounting for up to 80% of cases. Contact transmission can be direct skin to skin contact or indirect via contaminated objects or surfaces. So, can you comment how to prevent this contact transmission? So, please comment your interventions. How to prevent this contact transmission. Then, seventh question, which of the following is standard precaution that should be followed by all healthcare workers when handling blood and body fluids? Wearing gloves and mask, wearing gloves and a gown, wearing gloves and eye protection, wearing gloves, a gown, a mask and eye protection. So while handling blood and body fluids, the person has to wear gloves and eye protections. Wearing gloves and eye protection is a standard precautions that should be followed by all healthcare workers when handling blood and body fluids, regardless of the suspected or confirmed infection status of the patient. Even if it is normal case also, the person has to wear gloves and eye protection while dealing blood and body fluids. Gloves protect the hands from exposure to blood and body fluids, and eye protections prevents splashes or sprays from the sprays from entering the eyes. Then eighth question, which of the following is an example of a disinfectant that can be used to kill microorganisms on inanimate objects? So here keyword is disinfectant. So this question is a little bit confusing, or the options, after seeing options you will be confused. So option A, alcohol. Option B, antibiotics. Option C, antiseptics. Option D, soap. So correct answer is alcohol. Alcohol is an example of a disinfectant that can be used on inanimate object. That means non-living objects. We can use alcohol to it can be used to kill microorganisms. Antibiotics, it is used in living organisms, and antiseptic, it will obstruct the growth of microorganisms, and soap is an example of detergents. So that is why I told the disinfectant word you should take consideration while answering this question. Alcohol is an example of disinfectant that can be used to kill microorganisms on inanimate objects such as medical equipments or surfaces. Disinfectants definition means they are chemical agents that destroys most pathogens except their spores. Antibiotics are drugs that inhibits or kill bacteria inside the body. Same time, antiseptic means they are chemical agents that can be applied to living tissues to reduce the number of microorganisms. Soap is an example of detergent that removes dirt and grease but does not necessarily kill microorganisms. Ninth question, which of the following is a characteristic of gram-positive bacteria? In previous video also we have discussed about gram-positive bacteria, what is gram-positive and gram-stain, and we have discussed certain examples for gram-positive and gram-negative bacteria in previous video. So here also this question also related to gram-positive bacteria. Options are, they have a thin cell wall and stain pink with gram stain. They have a thick cell wall and stain purple with gram stain. Third option, they have no cell wall and stain blue with gram stain. Last option, they have a double cell wall and stain green with gram stain. Correct answer is gram stain bacteria have a thick cell wall and stain purple with gram stain. So that is a difference between gram positive and gram negative bacteria. Gram positive bacteria have a thick cell wall composed of peptidoglycan and stain purple color with gram stain, which is a technique used to classify bacteria based on their cell wall structure. Same time, gram negative bacteria have a thin cell wall. It will not retain the color, the purple color of the gram stain, because it has very thin cell wall, and stain pink with gram stain. So after the discoloration, the gram negative bacteria may seen as a pink color. It will not retain the gram stain color. Some bacteria such as mycoplasma have no cell wall and do not retain any color with gram stain. Same time, some bacteria such as cyanobacteria have double cell wall and it may stain green color with gram stain. So these are the different differences while doing gram staining process. So gram positive bacteria means it will retain the gram stain color, purple color, and gram negative bacteria, it will not retain the gram purple color, so gram stain color, that, and it will appear pink in color. But in case of mycoplasma, they have no cell wall, so that will not retain any color. And some bacteria like cyanobacteria have two different cell wall, and it will retain green color after the gram staining process. 10th question, which of the following is a type of isolation precaution that requires the use of a respirator or a high efficiency particulate air filter mask, that is HEPA mask? Airborne precautions, contact precautions, droplet precautions, standard precautions. Correct answer here, airborne precautions. So in the case of airborne precautions, we need to use a high efficiency particulate air filter mask. So N95 mask is needed in the case of airborne precautions. Airborne precautions are a type of isolation precaution that requires the use of a respirator or a HEPA filter mask when entering the room of a patient who has an infection that can be transmitted by a small airborne particles such as tuberculosis, measles, or chickenpox. These are the examples of infection that is transmitted through air. Contact precautions require the use of gloves and gowns when touching the patient or their environment. Droplet precautions require the use of a surgical mask, 3-layered surgical mask that is used to prevent droplet transmission when within 3 feet of the patient who has an infection that can be transmitted by larger respiratory droplet such as influenza, pertussis, or meningitis. So these are the infections transmitted through droplet transmission. So we can use surgical mask, 3-layered surgical mask when we are contacting the patient closely, that is within 3 feet distance. Standard precautions apply to all patients and involve hand hygiene and the use of personal protective equipments based on the anticipated exposure to blood and body fluids. Then 11th question, which of the following is the most common type of BPAD? So this may be a rare question that may be hearing first time for you. So BPAD type 1, BPAD type 2, cyclothymic disorder, rapid cycling BPAD. So which one is the commonest BPAD? So here correct answer is BPAD type 2. That is the common type of BPAD. So we will explain what is BPAD type 1, what is BPAD type 2. BPAD type 2 is the most common type of BPAD, affecting about 0.5% of the entire population. It is characterized by recurrent episodes of major depression and hypomania, which is a milder form of mania. So that is the important thing here. There will be major depression in both cases, BPAD type 1 and type 2. But in the case of mania, in type 2 case, there will be hypomania, very mild form of mania will be there when manic course of disease. And it will not impair the lifestyle or life pattern. But in the case of BPAD type 1, there will be a clear type of mania that it will affect the person's daily life. So that is the main difference with between BPAD and BPAD 1 and BPAD type 2. So I will briefly explain the difference here. So first BPAD type 1. BPAD type 1 characterized by at least one episode of mania. Full blown mania will be there in BPAD type 1, which is a state of elevated mood, energy and activity that lasts for at least a week and interferes with daily functioning. BPAD type 1 and type 2, both cases major depression will be there. Only the difference in the case of manic episodes. In BPAD type 1, there will be full-blown manic episode will be there. That is a state of elevated mood, energy and activity that will last for at least a week. At least a week it will be there. And in the case of type 2, BPAD type 2, it is characterized by at least one episode of hypomania, which is a milder form of mania that lasts for at least 4 days and does not cause significant impairment in daily functioning. People with bipolar 2 disorder do not experiencing full-blown manic episodes. So that is the main difference in the case of manic episode only, BPAD type 1 and type 2. So in both case, major depression will be there. But in BPAD type 1, there is full-blown manic episode will be there. It will affect that person's daily living. And same time, in BPAD type 2, hypomanic condition will be there. It will be minimum at least 4 days it will be there, and the hypomania symptoms will be very mild form. It will not affect the person's daily living character. 12th question, which of the following is a risk factor for developing BPAD? Family history of a BPAD or depression, exposure to traumatic events or stress, substance abuse or medication side effects, all of the above. Here, correct answer is all of the above. All the three options are may leads to BPAD. They are the risk factors for BPAD. Risk only. There is no if there is history of family histories there means there is a risk only. The child may or may not get to the BPAD. BPAD is caused by a combination of genetic, biological, psychological and environmental factors. Having a family history of BPAD or depression increases the likelihood of inheriting or expressing genes that predispose to BPAD. Exposure to traumatic events or stress can be trigger or worsen mood episodes in people with BPAD. Same time, substance abuse or medication side effects can also induce or mimic mood symptoms in people with BPAD. So these are the risk factors for BPAD, developing BPAD. 13th question, which of the following is a symptom of mania? Decreased need for sleep, increased self-esteem or grandiosity, increased talkativeness or pressure to keep talking, all of the above options. Here also, correct answer is all of the above are symptoms of mania. That is decreased need for sleep, increased self-esteem or grandiosity, increased talkativeness or pressure to keep talking. Sometimes they will leave the food also. Mania is a state of elevated, expansive or irritable mood that lasts for at least 1 week and causes significant impairment in functioning. Some of these symptoms of mania include Some of the symptoms of mania include decreased need for sleep, increased self-esteem or grandiosity, increased talkativeness or pressure to keep talking, increased goal-directed activity or agitation, increased involvement in risky or pleasurable activities, distractibility, and flight of ideas. These are the common symptoms of mania. Then 14th question. Which of the following is a mood stabilizer that is commonly used to treat BPAD? Easy question. Lithium, fluoxetine, diazepam, haloperidol. Correct answer is lithium. Lithium is drug of choice for BPAD. Lithium is a mood stabilizer that is commonly used to treat BPAD. It can reduce the frequency and severity of mood episodes and prevent suicidal behavior in people with BPAD. Even in the case of depression, lithium is needed because antidepressants also needed to give along with uh, uh, mood stabilizers. Otherwise, the excessive antidepressants will lead to manic episodes. Fluoxetine, second option, fluoxetine is an example of antidepressant that can be used to treat depression in the case of BPAD, but it may also induce or worsen mania in some cases. Because without mood stabilizer, if it is fluoxetine is used, means it will worsen the manic episodes, or it may induce mania. Third option is diazepam. It is an benzodiazepine. It is used to relieve anxiety. So that is anti-anxiety drug that can be used to treat anxiety or agitation in BPAD, but it may also cause dependence. So long use of diazepam, it will lead to dependence, or if it is abrupt withdrawal, it will lead to withdrawal symptoms towards diazepam. Haloperidol, fourth option, it is a antipsychotic drug that can be used to treat psychosis or aggression in BPAD, but it may also cause extrapyramidal side effects or tardive dyskinesia in some cases. Because it is a first generation antipsychotic, it has more extra risk for getting extrapyramidal side effects. 15th question. Which of the following is a psychological therapy that can be effective for people with BPAD? Cognitive behavioral therapy or CBT, interpersonal and social rhythm therapy or IPSRT, family focused therapy, all of the above options. Correct answer is option D, that is all of the above options. All are used in the case of treating BPAD. Psychological therapies can be effective for people with BPAD as an adjunct to pharmacological treatment. It can be used along with medicines. They can help people with BPAD cope with their symptoms, identify and modify their dysfunctional thoughts and behaviors, regulate their emotions and routines, enhance their interpersonal and social skills, and improve their family and social support. Some of the psychological therapies that have been shown to be effective for people with BPAD include cognitive behavioral therapy, that is CBT, interpersonal and social rhythm therapy or IPSRT, and family focused therapy. These are the therapies useful in the case of controlling or rehabilitating BPAD patients. So that is about today's video. So we have discussed 15 questions from psychiatry, some infection control nursing. So these are the some repeated questions asked in the NIMHANS nursing exam. So it will be helpful for preparing upcoming NIMHANS exams. So we will come with another video soon. So till then, please stay tuned. And those who are not subscribed to our channel, please subscribe and share with your friends. So thank you. If you have any doubt, means you can ask in comment sections. So I can understand your knowledge level also. So I can prepare next video according to that. So thank you for watching this video. Bye bye.